The Helping Young People Choose the Birth Control Method Right for Them resource tutorial is a 5-part tutorial developed by Activate. Activate is funded by the Office of Population Affairs to translate sexual and reproductive health research into resources for professionals supporting young people experiencing the child welfare or juvenile justice system, homelessness, or disconnection from school and work. Activate previously developed a resource that professionals can use to facilitate conversations with young people that center young people's birth control preferences, needs, and priorities. The purpose of this tutorial is to illustrate how to use the resource. It was developed with input from youth supporting professionals who might use the resource and young people who might benefit from its use. The Helping Young People Choose the Birth Control Method Right for Them resource is a 2-part research-informed resource created by Activate. The resource is designed for youth-supporting professionals who want to help young people make informed decisions about birth control. The first part of the resource is the Birth Control Methods Guide that includes instructions for using the guide, background information, reflective questions, conversation starters, and a matrix that includes 18 birth control methods. The background module reviews what we know about the factors that influence young people's choice of birth control methods and describes the different categories and methods of birth control found in the resource. Modules 1, 2, and 3 show how the reflective questions, conversation starters, and matrix can be used. The second part of the resource is a booklet that includes detailed information about the 18 birth control methods featured in the birth control methods matrix. It also includes a glossary of reproductive healthcare terms, such as long-acting reversible contraception. Module 4 shows how the booklet can be used. We developed the resource using a 4-step process. First, through Activate's needs assessment, we identified a need for a resource that helps youth-supporting professionals empower young people to choose a birth control method that is right for them. Second, we reviewed the literature on factors that influence the birth control choices young people make. Third, we sought input from youth supporting professionals and young people on the content and format of the resource and how it might be used. Finally, a pediatrician and public health professional with expertise in adolescent medicine and pregnancy prevention reviewed the resource to ensure its medical accuracy. This is Module 4. It illustrates how to use the birth control methods information booklet. The background module reviews what we know from research about the factors that influence the birth control choices young people make and provides information about the 5 different categories of birth control methods. Module 1 describes how to use the self-reflection questions in the Birth Control Methods Guide. Module 2 explains how to use the conversation starters in the Birth Control Methods Guide. Module 3 explores how to use the Birth Control Methods Matrix in the Birth Control Methods Guide. After completing this module, you will know how to use the information booklet to provide young people with medically accurate information about birth control methods.
The Birth Control Methods Information Booklet provides medically accurate information about birth control methods. Youth supporting professionals can use the booklet to educate themselves about birth control methods or share information with young people about the birth control methods they are considering. The booklet includes the 18 birth control methods featured in the Birth Control Methods Matrix. Each page looks like this. It provides information about the type of method, available brands, who can use it, how it is used, how long it lasts, whether it requires an appointment with a healthcare provider or a prescription, whether it prevents STIs, the failure rate, potential side effects and benefits, and less common risks. This particular page provides information about a type of IUD. This page provides information about condoms. The information booklet also includes a glossary of reproductive healthcare terms. For example, it defines barrier birth control methods, a category of birth control methods.
Now we will walk through a scenario that illustrates how a youth supporting professional might use this resource. In this scenario, the youth supporting professional uses the information booklet to provide medically accurate information. Sam is a 19-year-old young woman living in a homeless shelter for unaccompanied youth. Sam tells her case manager, Lisa, that her doctor recently prescribed her birth control pills, but she is afraid to take them because she has heard that birth control pills can cause infertility or cancer. Lisa wants to educate Sam with medically accurate and complete information so Sam can make an informed choice about whether or not to take her birth control pills. How might Lisa use the birth control methods information booklet in this situation? It is important for Lisa to first recognize that building rapport and having a trusted relationship will be key to having this conversation with Sam. This is an opportunity for Lisa to serve as a trusted adult in Sam's life and educate her more about birth control. Lisa can also acknowledge Sam's fear and express concern that some of what she has heard about birth control pills might not be medically accurate. Then she can use the birth control information booklet to provide Sam with medically accurate information about birth control pills, including their side effects, risks, and benefits. Lisa can also print out relevant pages of the booklet for Sam. The information booklet provides information about two types of birth control pills. Page 6 provides information about the combined pill, and page 7 provides information about the progesterone-only pill. Lisa can review the information about both types of pills with Sam and compare their side effects, benefits, and risks. Lisa can point out that infertility and cancer are not listed as known risks for using either type of pill, and that the combined pill may actually prevent endometrial and ovarian cancers. Lisa can also point out that using the combined pill is associated with some rare but serious risks, such as high blood pressure or blood clots, but the progesterone-only pill is not. After reviewing this information, Lisa can ask Sam whether her feelings about taking birth control pills have changed. In addition to providing Sam with medically accurate information about birth control pills using the information booklet, Lisa can encourage Sam to make a follow-up appointment with her doctor to further discuss her concerns. She can also use the birth control methods matrix, which was the focus of Module 3, to help Sam identify other birth control methods that are aligned with her needs and preferences. Finally, Lisa can continue to check in with Sam to ensure she is getting accurate and complete information about birth control that she might not receive from family, friends, or social media. Youth supporting professionals can use the birth control methods information booklet to provide medically accurate information about birth control methods to young people, address questions they have about methods, and compare different methods. We would like to acknowledge the youth supporting professionals and young people with lived expertise who contributed to the development of this tutorial. Please contact Activate using the email address listed if you have any questions about the tutorial. All 5 of the tutorial modules can be found on Activate's website at activatecenter.org.